Hello, I'm Will. Welcome to ResearchPod. You may have heard of the Hippocratic Oath, a historic guide to medical ethics from which we draw the quote, "First, do no harm." You may not know the line further down the text, "I will remember that I do not treat a fever chart, a cancerous growth, but a sick human being." Today I'm talking with Dr. Jürgen Riedel and Professor Kourosh Saeb-Parsy of Oxford Immune Algorithmics about a more precise, personalised and preventative approach for immune health monitoring when coupled with AI and machine learning technologies. Their work on proactive, patient-centric approaches in medicine is part of a significant shift in managing health before it turns into illness.
I'm Jürgen Riedel. I'm the co-founder and CTO of Oxford Immune Algorithmics. We are a biomed company. I am passionate about data in all forms of shape, information, and certainly human health and beyond.
And Kourosh, hello.
Hello, my name is Kourosh Saeb-Parsy. I'm Professor of Transplantation at the University of Cambridge and Chief Medical Officer at Oxford Immune Algorithmics.
We're talking about the work on blood screening and AlgoSite. It makes a lot of sense how you get to that from the immune algorithmics side of things coming from a biological background. Jürgen, if we could hear a little bit more about how your experience and interest in data has led you to, I'm going to be honest, a little bit of a niche interest.
Sure. I started as a computer software developer. So I came into that world of data and discovered quite early that data is a powerful driver in any kind of business. I started working for investment banks, private banks, and that led me further to look into data more deeply. So I think about data patterns to basically understand what is the essence of data for any kind of businesses. And that led me to business intelligence, look at databases. So I became a database expert, and also led me to the point of how to visualize and make a story out of data. Now, the other part of my passion about data is also because I'm a physicist by training, and the physicists like to understand what are the underlying principles that govern the creation, but also the uses of data. So those combined brought me to this point of convergence, which then led me to the application of not only data for businesses, data in natural sciences, but also in living organisms and life itself, to understand what governs information in living structures, how data and how information can help to improve people's lives using artificial intelligence, system biology, physics, medicine to create precision medicine tools.
And Kourosh, I imagine it's something of the reverse for you, coming from a very wet science to the dry and hard bioinformatics that we're talking about today.
That's right. As a doctor, I've always been fascinated by the way that we monitor our health status and how we diagnose disease. And my interest here arose because it always seemed to me strange how we categorize patients' blood results into a binary format, where results are classified as normal versus abnormal, except the reference ranges that we use for these categories are actually very broad. So you can have very large changes in some of the lab test values and still remain within the normal range. To me, this is a very crude way of approaching the analysis of the data. What makes more sense, I think, is to understand the baseline values for a given individual so that we can start detecting deviation from that baseline. Now, if we're going to do that at large scale, we will end up generating huge volumes of data. And then the challenge becomes, how do we acquire this data? How do we analyze it? How do we integrate it with other relevant data, such as health status and clinical science? And this is where the problem or the challenge has two facets. One is the technology required to gain access to that data. And then the other equally important and perhaps more difficult challenge is, how do we analyze this data? And this is where artificial intelligence and machine learning and the tools that we are developing with OIA come in.
You mentioned the idea of having deviations from the norm and a personalized approach to healthcare, and personalized medicine being the big umbrella concept, the utopian future of medicine, that you are treated to return to the best that you can be in terms of any blood score, metabolic function, any disease state. There's a lot of data and there's a lot of people. So in terms of how we can put that across an entire lifetime as well, the philosophy of biological markers over time, just to kind of expand on what is normal versus disease versus just getting a bit older, perhaps.
That's right. So you're absolutely correct in that this idea of personalized medicine has been talked about for a long time. But we don't really apply it to everyday delivery of healthcare. What do I mean by that? So let's take the medical test or diagnostic test or blood test that is most frequently performed in the world. That's something called a full blood count. So this is the blood test where a small sample of blood is taken and then we count the number of white cells in somebody's blood. Now, this is the most commonly performed test worldwide. Several billion are performed every year. So this is something that we should be thinking about. Well, how do we personalize the analysis of the data we get here? But we don't at the moment. As we said earlier, what we do is we categorize the results we get from a patient into these large reference values. So an approach to personalization of that would be to understand what the number of a particular subset of white blood cells are in my blood. Let's take lymphocytes. They're a type of white blood cell, important in many conditions, including cancer and fighting infection. What we argue is that we need to understand what the number of those cells in my blood are, and then be able to track them over time. What that allows us to do, or what that will allow us eventually to do, is to understand when I start to deviate from that baseline. And this may be an early marker of disease, or it may be a marker of response to treatment, or as you say, it may be a marker of aging or some other physiological process that we're not even aware of, right? It may be to do with the seasons, or it may be to do with the time of day. But gathering this longitudinal data is at the core of personalizing our approach to this particular blood test. And if we were going to personalize anything, I would argue, well, why not start with the most commonly performed test worldwide, right? That would be a good starting point. It's a test that's commonly performed. It has utility. In other words, it has value. Clinicians use it. They make decisions from it. So this would be a good starting point for personalization of approach to blood testing. It's not the end of it, but we believe it's a really important and good first step.
Well, I feel I'd be remiss if I weren't to mention that we're recording this in March 2022, what feels like kind of at the tail end of a global pandemic, though numbers are rising, and that's all based on people doing regular tests, which I suppose is a very slim slice of personalized medicine in action. If I could maybe just pick your brains about how the pandemic has fit into this worldview and how that's fitting into healthcare systems as well.
Great point. And the pandemic really does exemplify how our current approach, while it has been effective, is arguably not sustainable or at best inefficient. So the way that we have dealt with the pandemic, a series of measures, but we know that vaccination has been really important and has had a very beneficial impact. But naturally, the way we had to respond to it was to say, well, let's vaccinate everybody as many times as is required. And we did that in the UK and in other countries, whereby everybody had a first dose, then everybody had a second dose and a third dose, and so on. The problem with this approach is that it is not sustainable. If we have further waves of either this virus or others, the idea that we take a population of 60 million people in the UK and actually we vaccinate everybody every few months, it's both economically and logistically a very difficult task. We know that different people respond differently to either the virus or to vaccination. So a personalized approach would be to say, well, we need to understand how a person's immune response evolves to being vaccinated or to having the virus. Once we understand that, we will be able to distinguish who requires, for example, another dose of a vaccine booster, or who is at risk of contracting the virus or at risk of actually having clinical symptoms from it. So a personal approach to this would be to say, rather than vaccinating everybody every 3 months, we do regular longitudinal monitoring of the immune system. We understand how, for example, the levels of the antibodies that are generated after vaccination and the level of lymphocytes or white blood cells to the vaccine changes with time. Once we've collected some of that data, then we will understand better who needs repeat vaccination most or who is at greater risk. So the idea here again is not to treat every member of the population exactly the same, but start to delve into the detail of who is at risk, who needs particular or additional protection. Now, this concept actually, in the context of viruses, is not new. We've been doing that for decades for things like hepatitis B vaccines. So many people, particularly clinicians who are exposed to the virus potentially, are vaccinated against hepatitis B. What we don't do is to say, well, every clinician needs to be vaccinated every several years, right? What we say is, once you've had 2 doses of the vaccine, you get blood test, and if the levels of your antibody aren't high enough, then you get a booster. So the idea is to have the same approach to the pandemic. But in order to do that, we need to gather the data so that we understand what these thresholds are. And this is the importance of generating data, being able to track it, and importantly, being able to analyze it.
When thinking about whole body wellness, there's immunity, there's inflammation, there's metabolic markers. I suppose to give a kind of a brief overview of the human biome and various microbiomes therein, how can one estimate a decent well-being baseline for someone? What's an out-of-the-box human look like?
So human physiology is, of course, very complex. We have different organs and different systems in our body. The immune system is one of them, but we have the cardiovascular system, which is the heart and the vasculature, the respiratory system, the lungs. We have the renal system, so the kidneys, the liver, and so on. And of course, these are all interconnected and they interact with each other. So to get a really detailed picture of the human health or disease, we would need to capture data on all of these systems. Naturally, that's a complex task, and we have to start somewhere. Now, our proposition is that the immune system is a good place to start. The reason for that is there is now increasing evidence that the immune system actually contributes to and impacts the well-being and the function of all other organ systems in the human body. Of course, we've long known that the immune system is important for infections, right? Responding to viruses or bacteria. We've, over the last few decades, begun to understand the role of the immune system in either the emergence of cancers, but also the response to cancers. But there's now good evidence that the immune system is also important in our susceptibility to other diseases that historically were not thought to be immune-mediated. So these are things like heart disease or mental disorders, depression, diabetes, and so on. What's more, we now recognize that the immune system is also important in normal daily function, things like sleep or mental performance or physical performance or recovery from injury or exercise. So actually, the immune system has an integral role to play in a variety of different conditions. So from that perspective, again, if we were starting somewhere and we said, look, we want to generate comprehensive longitudinal data starting with one system in the human physiology, we feel that the immune system is a good place to start. That doesn't mean that it is not important to measure blood tests that tell us about kidney function or liver function. But it just means that if we were going to start somewhere, we think the immune system is a good place to start. And the immune system is also particularly complex. It has many different components of different types, different cells and different cell types that have different functions, different soluble factors, so different small molecules or different proteins. So its complexity also means that it lends itself well to analysis using a sophisticated approach, which is why, again, it becomes a good target for applying artificial intelligence, machine learning, and advanced bioinformatics tool to understand the immune system and its implications for both health and disease.
which I suppose is where, Jürgen, your experience and fascination and mastery of all things the data comes in.
That's correct. And I think I just wanted to continue what Kourosh has elaborated, that the immune system is a complex system, right? I mean, the whole notion of complex system is not new. I mean, we know weather is a complex system, right? Like a flock of birds, they are complex. A school of fish, they're complex systems, right? But yet, beside all the complexity which we know exists, and especially of human body as a almost like the prime sample of complexity, if you can put the brain, right? The notion of using data also has the idea that there are underlying rules which govern data or generating the data we observe, right? And so that's basically the approach we also utilize if we talk about machine learning. And that is one way to look at it in the statistical point of view. So you sample lots of states of a system, which is like measurables, so blood tests, different tests, even like sensory input and so on. But then on the other hand, you also then have the notion of simple patterns you discover in those complex data sets, right? Which are statistically derivable. You can have inference and say, okay, if I see that kind of pattern, then I would say the other, and if I observe pattern A, I would observe pattern B in a given time frame afterwards, right? Now, that doesn't really tell you much about the data and underlying principle why data is generated. So if you look a little further and think about AI not a statistical tool, I mean, AI is, by the way, a universe of different disciplines. And one approach is what we are pursuing is looking at generating models of data, right? So we're looking at data and basically look at what kind of sort of structures or in principle can generate the data and thus explain it. And therefore, we have sort of a causal relationship between events occurring during a period of time. And that's certainly also very important if you look at the immune system, because if you want to say you observe a spike of white blood cells over a given time frame, you certainly would like to know if that spike appears again or when it dies down, but also you would like to know what the underlying cause, right? Because that's really, if you know the cause, then you can prevent all the other spikes in the future, right? You don't have to wait until they come for you, right? So that's the idea we pursue. And I think that's really where we augment the existing machine learning with our causal AI, which we call it, or neurosymbolic AI, and basically mine those structures which explains the data and therefore give us a more holistic view of a patient or a user. And so the idea also that is underneath is that having that model, we can also create a baseline. And we talked about personal baseline, precision medicine. What does it really mean? It means that we create like an individual model of a person, right? And we know persons are not the same, and we accept it in many other areas, like in social settings and political settings. We accept it even in education nowadays, which is also was a long struggle. But in medicine, we are sort of struggling with that notion that personalization is important. I mean, that is what we want to change, but that is strange in lots of ways, because that's like, for us, I would say the most important assets we have: a good life, good health, but yet we try to generalize it population-wise and so on. That's where, again, the fascination of information and data really merges together with the need of personalized medicine and also for improved health.
This is about a fundamental change in our mindset in terms of gathering data. Our approach to healthcare historically, and this is true for centuries, if not decades, is to only gather data when things go wrong, right? So the process of gathering data starts when a patient presents with a problem, with a medical problem. And we say, okay, what information do we have? Let's do all these blood tests. Well, actually, we should be gathering data long before these events occur. That will allow us to better understand what it is to be healthy. We can then hopefully start to detect deviations from that healthy baseline sooner, rather than having to wait until a patient actually has symptoms. people will say, well, there's no need to measure this particular blood test because this patient is healthy. Well, we would challenge that and we'd say, well, they may be healthy in that they don't have any overt clinical symptoms. But unless we gather this data, we won't really start to understand at what point some of these parameters start to change before they present with symptoms. Or we shouldn't really measure this because we don't know what it means. Well, to me, that is precisely the reason why we should be measuring it. If we don't know what it means, we will never know what it means unless we start measuring it and we start correlating it with things that we do understand, like clinical symptoms. Now, of course, this has to be done in a responsible manner. We need to be careful that the data is managed appropriately, the data is secure, people's confidentiality isn't breached, and also that people aren't exploited through the process of donating their data, whether that's financial exploitation or otherwise. So we have a responsible approach to this. But our fundamental principle is that we need to gather this data not just during disease, but also during health, in order to be able to make diagnosis earlier and to guide management of disease more effectively.
Prevention being better than cure, even down at the molecular level.
Absolutely.
To bring all of this to a very specific example, the paper that was published recently on blood test risk stratification, to summarize how one gets from a fluid sample to data to analysis to color scoring, maybe handoff between you as that literal handoff of sample works.
That sounds like a good approach, yeah.
I can start with the concept of what we are trying to achieve, that when we are monitoring different types of data, it can be difficult to really follow all these trends and be able to assimilate a message from these trends in a way that is simple to understand and has utility. If we were to, present a clinician with 10,000 different data points and say, look, you just look at all those things and process them in your mind and come to a solution, well, that's not impossible, but it is challenging. The idea is for us to combine different data or even data sets into an easily understandable signal that can help a clinician manage their patients better. We already do this in different concepts. So we have, for example, something like an early warning score. The idea with an early warning score is that it's a collection of physiological parameters from a patient that, when put together, just gives a signal to a clinician or to an observer whether this patient is getting better or worse. This has been done now for many years for monitoring things like blood pressure, temperature, and heart rate. The idea is that if you were to monitor each of these individually, you put them together to give you an early warning score. And if they're going in the wrong direction, right, if they're deviating from normal towards abnormal, that means your patient is getting worse. This is a red flag that you should be attending to this patient. Whereas if they're going in the right direction, they're getting better, well, your patient is responding to treatment. So that's the concept of creating a score. Except that type of approach has not previously been applied to blood results. And actually, blood results are much more complex because there's more of them. Different blood tests are performed in different contexts. So what we've done is we've applied this concept to a collection of different blood tests. Think of these as a basket of blood tests where we are combining the blood results that fall into a basket because they're related to each other, and then quantifying how these blood results, both individually but also as a set, how they deviate from, first of all, what the population reference values are, how they deviate from that person's individual or personalized reference values, and also how they change over time. So by monitoring this deviation over time, we can get a feel for whether this patient is getting better or worse, or we could triage patients based on who needs most attention. So that's the concept of creating a score. And we've done that for different baskets of blood tests. So we've done them, for example, for all the components of a full blood count, also known as a complete blood count, which has the red cells and the white cells in it. And this gives us something called an immune score. But in principle, we can do this, and we do this for example, blood tests that are related to monitoring the health of the kidneys or the health of the liver. So that's what the concept of a score is. It's a tool that brings together information in a sophisticated manner, but actually makes the information then more accessible to clinicians. And it becomes a tool for the clinician to use to manage their patients more effectively.
So the idea is to take the baskets and the analytes, those are the subunits of a test. So an analyte is like the number of white blood cells, red blood cells, different type of blood cells, and so on. And then we basically take the data and transform it into an immune space, we call it. So where we basically map the data which have different units, there are counts, sometimes they are like a concentration, and map them into a unified immune space. It's like an abstract mathematical space. And then basically apply the analysis, how much each of the data points deviate from the mean. We start with the population mean, as Kourosh explained, and basically give the deviation sort of a value. And this value in total, if the whole basket is one number, can basically be a number between 0 and 10. Right? So that's where basically 0 is it's not good and 10 is very good. You're smack on, the standard, right? Now, that certainly is not true because there are no standard units, right? Therefore, what we do, and we observe then data over a period of time. So we collect different samples over a period of time and look at longitudinal data and basically adapt from that population base reference values, which is huge, to a personalized sub-range, if you will. So basically, if you think about a band from min or maximum, and you look at your data points, you fluctuate not between those absolute population minima, maxima, but in a more narrow band, right? You may be on the upper or lower end of the population band, but your band is much smaller and you fluctuate ideally only very minimal. And that's true for the immune system, because the immune system is precisely there to buffer all the turbulent things happen in the body and keep the body like an even keel, right? So that's the whole idea about the immune system. So if there are any kind of perturbations, they are mostly dealt with. But if they are too big, the immune system somehow caves in and has to react more dramatically. And that we would see in the slight deviation from the mean. And basically what we do, we calculate the mean for the individual band, not the population band. Therefore, we are much more tuned into what is really a real deviation of that person's baseline. And if that is happening, we flag it. And we have like a color code for the green, everything is good. Yellow is you're above one standard deviation or within one standard deviation of the absolute minimum maximum of your band. And then red is if you go beyond, right? And that again is captured in one number. And we also have the color band, that gives you an indicator also from which direction you're going, from red to yellow and green, or you move away from green to red. And that is very important information for physicians because they can triage patients much more efficiently, faster, and don't have to juggle with so many different plots and diagrams. And I think the danger is also that lots of tendencies are overlooked because you have a tunnel view, you only look at certain analytes because it makes sense, maybe the patient has certain conditions, but overlooked a totally different range of analytes which might be very important for that use case. So that's basically what we do with the paper. We describe the method, how we do it, how we set up this score space, how we calculate the score, and so on.
But all of that process of taking all of that data, all of those data points and coming up with green good, red bad, how much time does that take to kind of put that into clinical process of a patient is admitted to hospital, gets bloods taken within maybe the first 4 hours? How quickly can someone have some actionable data coming out of that?
So the good thing about our score is that it can be generated as quickly as the blood results are available. Now, generating one score is valuable, but the real value comes from tracking this score, right? So that whether you can see that it's getting better or worse, by that I mean it's going towards normality or away from normality. So that's why, again, the longitudinal monitoring is important. But there is also a way of using the score as a tool to triage patients. What I mean by that is, imagine that you're seeing 100 patients, which sometimes can happen in the clinic, and then you've got a set of blood results for 100 patients, and you're thinking, well, which ones should I start with in terms of reviewing the data? Well, at the moment, you either do them alphabetically or by random selection or based on the time that you saw them in clinic. Another way of doing it, if a score was automatically generated for every patient, say, well, I'll start with the ones whose blood results are most abnormal, or the score is worst, if you like. And that means that you can focus on those patients first, review their blood results, and then gradually move towards the ones that have more normal blood results. So those are sort of two applications of either an individual score or a score as it evolves over a period of time. Another type of use of this score is that actually, as a clinician, eventually you can create your own basket of blood cells. Let's say that for my patients, I'm really interested in what happens to their, let's say, liver function test, as well as a subset of their white blood cells and maybe their hemoglobin, right? Actually, you can create a basket that has those components in it for yourself, for your patients, and then you can monitor that. So there is flexibility in the system. Of course, over a period of time, the idea is to validate clinically the utility of these scores. What it means is when you track them over a period of time and then they start correlating with how patients respond to treatment or how their condition evolves, then that allows us to modify the score, improve it, and make it more useful. Exactly how it was done with the early warning scores that we were talking about earlier. So those have evolved over a period of time. If you had a basket that had 3 different components in them, so let's say it was heart rate, blood pressure, and temperature, well, you could give these equal weight, right? You could say, look, actually, they contribute a third to my score each. Or you could say, actually, it looks like temperature is really important, right? So let's give 2 points to temperature and 1 point to blood pressure and heart rate, or vice versa. And the weighting and the way you combine these could evolve over time. Or you could say, look, actually, maybe we should add, another component to the score, which is, let's say, level of pain. So these scores are designed to evolve over time and be refined and optimized. And actually, the algorithms over time may be able to do that, right? It may be that actually the algorithms can be designed in a manner that they learn, they incorporate data and say, like, actually, this component in the basket doesn't really seem to correlate much with a health outcome. So we can reduce its priority or even remove it from the basket, but this other parameter is important.
Thinking forwards, where do you see the future for that branching out, possibly bringing it out into society? I'm thinking of long-term disease, some kind of life-limiting condition where they are doing that monitoring already, and that you have perhaps something to action more readily out of that when you can turn up with a very simple score at the doctors and say, I know for a fact that my potassium is off or something. Kind of taking that to a lifestyle approach towards health rather than just an incidence base.
That's exactly right. It's about being proactive in measuring health and generating data and monitoring that data rather than reactive. And actually, we normally, not only are we reactive, we react very late. Our trigger for a reaction is normally a health event, right? It's a bit like, we start looking at the stable door once we find that all the horses are missing, right? Whereas actually what we should be doing and saying, well, actually, let's have a system where we look at the hinges and the locks on the door once a year. And once we know that they're loosening, we can do something about it before the horses have bolted.
The health MOT, I think I've heard it talked about. I've heard about that for years and years and years, but the phrase is out there.
That's right. So the concept of doing that type of health assessment on a regular basis has been around for a long time, but actually the concepts now need to be actioned, right? That means that we need to create mechanisms for generating and gathering the data, and then mechanisms for analyzing all of this data, right? There's no point doing blood tests all the time if this information is never integrated, gets lost, nobody analyzes it, then that has no utility. So this is where Oxford Immune Algorithmics is making an impact, is to create those strategies in the infrastructure, first of all, to generate the data itself through some of our point-of-care blood testing technologies that we're creating, generating the platform where all of the data can be hosted in a secure way, and then the critically important algorithms and artificial intelligence and machine learning approaches to analyze all of that data.
Machine learning and artificial intelligence has been presented as a developing concern for the future through various opportunities and various gun-wielding robots. So, could maybe press you, Jürgen, for a little bit of your thought on the near future or far future of how that comes together in terms of having personal models for health, but then just like the sheer volume of data that's going to be rendered for the next couple of generations, the people who will have this as an opportunity from birth over the course of their life.
With machine learning AI, you may not need to look in the far future. It's 10 years already is a giant leap for imagination. But I think they are like, as you said, I mean, there's certainly opportunities, but also negative sides, obviously. And those where information or knowledge can be misused by creating evil machines, which is not help but control people and basically come back to the old system that other few people control the masses. Right? Now, we argue that we certainly acknowledge it, but also we see the other side of the potential that precisely that can help mankind to improve health, that health and not a good health system creates lots of issues. And I think that's where we would see that the AI can really make a fundamental difference, so that the penetrability use of data and also to connect different data points and diseases, so networks, and see like a holistic picture, which is like population and global, but also extremely individualized, so very laser focused. And that's our hope, to improve the way we actually looking at wellness, health, to sustain a better life, and also to create new opportunities for mankind, if you will. And what the hope is that that really eradicates most of the issues. I mean, we won't eradicate all of it, but if you extrapolate that, that can be a brighter future for us. And the other challenge is really also having lots of data is also to really deal with it in a responsible way, how we eliminate bias, how we actually may not need that many data, but learn how to use little but have better data. I think that's also another point. I mean, we certainly need to also improve the way we collect data. That is also a very important part of improving AI, and to really build proper models about our world and help us to improve, rather than creating like giant bias machines. You can arguably think about those large language models, which are now very popular, who actually can answer you all kind of questions. But they are certainly, I mean, they create art, they create programs, but they are just language models which are extremely biased the way the social interaction are set up. So we need to really take that not as a blueprint, but we have to go to the direction where we curate data and I think really look at data responsibly. And I think that would be a new domain to conquer. I think we are going away from this hunter-gathering of data to really curating and farming. You can almost basically think about data farms. You go from uncurated to curated data to data plans, and to really have data mines to really understand and prepare data so that it can be used responsibly AI purposes. So I would say that is like a challenge we have to do in the next years.
To pose a final challenge, I recently moved house. I moved from one city within central England to another. The mismatch between the health systems in one city and another has caused no end of problems, and that's through systems compensated through a national health service. I am not having to pay for going to doctors to make these appointments to get kidney tests done. Had kidney stone. It was horrible. Kind of embedding this into a sociological approach to health and a society level approach, unifying health systems and accounting for costs and access across even a fairly modern society such as in England, where there is still a large inequity of access to healthcare, of access to the facilities that enable people to seek healthcare, things like childcare or paid time off work. Where does the whole discussion that we've had so far fit within what needs to transform in a society, in a healthcare system, in a public healthcare model that lots of the world still doesn't have access to?
The inequality in access to healthcare is very apparent across the world. And actually, that drives some of our attempts and inspirations for developing new technologies. We talk about democratizing access to healthcare. And the way we fulfill that promise is to say, can we create technologies that allow people to have access to, for example, blood tests remotely without needing complicated, expensive machines and laboratory equipment? Can it be done at the point of care in a village, in remote or rural areas? So we are trying to address those challenges by creating some of those technologies. And then in terms of the data analytics, again, our systems are designed to be based in the cloud so that actually anybody from any part of the world, as long as they have access to internet, then they can utilize these analytical tools, and it doesn't require very expensive purchases. This is very different to some of the other solutions that have been generated. So electronic medical record systems that sometimes cost hospitals tens, if not hundreds of millions of pounds or dollars. So again, our approach is to democratize access both to the technologies that help generate the data, but also the technologies that help analyze that data. And our systems are designed so that they can be integrated into other existing laboratory data systems.
Yeah, I think that's really also for us very important to make the technology available for everybody. I think we actually develop technology which is actually utilizing low-end technology that is feasible and that is affordable, but very potent. And I think that's where we basically we are not at the edge of latest technology, but we are at the edge of converging existing technology to penetrate areas or markets which would be very difficult to penetrate with high-cost machines, which the healthcare system is basically saturated with humongous machines, centralized labs, where there are only few people have to excellent healthcare, excellent machines, outer worldly machines, but 99% doesn't, right? And I think that's a very huge challenge. I mean, even think about fresh water is a huge issue, right? So think about if there would be machines distributed just to create fresh water, right? Or the drinking water, that would change the landscape. Something similar we want to do with access to precision healthcare, mainly through the use of blood tests, which are very important. Any kind of, especially malaria, for instance, is a huge issue still, and any other kind of avoidable diseases, if you will, but extremely disturbing for many developing regions, that can be addressed and also be eliminated, right? And I think that's what's for us really also what's a driving force. I mean, certainly you can add machines to existing super high-tech healthcare systems, but I think we see the potential on the 99% as well, right? Where we can make a global impact.
Is there anything more immediate that you happen to be working on? Any new applications, any upcoming publications as well, that if anyone wants to see what is next for AlgoSite or Oxford Immune Algorithmics, that they can keep an eye on that might be coming up? Anything on the horizon?
So one of the things that we're continuously working on is to use existing clinical and health data to validate our approach in our algorithms. So we've been getting access to anonymized historical data from different sources. And one of the things that we will be working on in due course is to use that historical data, some of which is longitudinal, to generate insights into the things that we talked about: early diagnosis, response to treatment, and of course, optimize our approach and our scores and ensure that they correlate with clinical endpoints that are of importance for patients and for clinicians.
The other direction is we talked about the immune system, so that we explore the immune system through the most common blood tests. But the other next direction is also go vertical. Look deeper into the immune system, look at the differentiation in the immune system, the subsystems, if you will, and basically then we go the horizontal way again and basically create new scores, new insight, connect the different scores to gain more insight into the immune system, and also to create links to multiple diseases, which I think they are still very unknowns. And for instance, the other dimension I think we briefly mentioned is a microbiomic, looking at the body as a collection of entities, which is based on our cells, but there are a host of other single organisms inside our body which are very fundamentally involved and connected to the immune system, which potentially is very much an indicator for wellness, and also to connect that and really expand our understanding of the immune universe. I think it's important that we make healthcare a really individual issue. It is arguably a fundamental right to be healthy, right? I think that is something, the empowerment we see in it. And I think that's the dimension we need, also the awareness that we go away from large health systems, which have like old networks, old approaches, outdated approaches, and basically go towards a more individualized healthcare access, and also the emphasis from sick to healthcare. And I think that is sort of in conjunction with all the technology advances we assume AI will bring us, but we need also to change systems with it. That's really the most fundamental aspect of it. And I think together with that is a very potent aspect of our near future.
We need to gather as much longitudinal data in a responsible manner so that we understand health better and can prevent and treat diseases more effectively.